Hello everyone, my name is Melissa Shields and I will be presenting today about the effectiveness of an alternative learning package for first year nuclear medicine students. Traditionally, our first year students at the University of Newcastle, as part of their nuclear medicine practice course in second semester, participate in weekly radiopharmacy labs. These labs are designed to introduce and develop fundamental skills in radiopharmacy, including radiation safety, basic needle handling and aseptic technique, generator elution and quality control, kit reconstitution, and dose preparation. Our radiopharmacy lab has 10 student benches and an instructor's bench, each fitted out with a commercial L block and the necessary equipment to maintain radiation safety in the workplace. The first year students generally use saline instead of radioactivity, as they are still developing their skills and confidence. As part of this course, the students also undertake a 2-week clinical placement. This placement is designed to give the student a better understanding of the profession as a whole, helping them to decide if this is the career for them. Placement also helps develop communication skills between themselves and the patients and staff, develop technical skills not easily taught at university, as well as putting into practice the theory learnt beforehand. However, the COVID pandemic has thrown us all many challenges. For us at the University of Newcastle, it meant we had to reduce the number of students in each lab class from 10 to 6 due to social distancing restrictions. We had to reduce the amount of time in the lab each week from 2 hours to 1 hour, and we had to cancel the 2-week clinical placement. To account for the loss of teaching time in the lab each week, I made a set of 6 instructional videos with the help of the learning media team at the University of Newcastle. The videos were relatively short and focused on the learning outcomes of each lab. For example, this is a snippet from the dose calibrator operation video. Students were instructed to watch the corresponding video before each lab to familiarise themselves with the material to be covered each week in order for the labs to be conducted in the reduced time frame. To account for the lack of placement, a clinical alternative portfolio was developed. This portfolio aligned closely with the learning outcomes of clinical placement. The modules consisted of communication, work health and safety, case study writing, and an introduction to nuclear medicine practice. The communication module consisted of a theoretical component discussing communication techniques and the importance of effective communication, as well as a face-to-face communication workshop where the students were able to interact with each other and participate in scenario-based role-playing exercises, albeit within COVID-safe guidelines. The Work Health and Safety module was developed to inform students of the protocols and processes in place to maximise safety in the workplace. As well as being a key capability in the MRPBA Professional Capabilities document, young workers may be less aware of the WHS risks and responsibilities and therefore at more risk of a workplace injury. Writing case studies is an integral component of clinical placements within the nuclear medicine program at UON. Students were taught how to write case studies and were required to choose a pathology commonly imaged using bone scans and write a modified case study. Lastly, the Introduction of Nuclear Medicine Practice module introduced the students to bone scans and the operations of a gamma camera. Videos were made by GE and Siemens for the students to view all of the different functions of a gamma camera. Students were then assessed in different ways for each of the modules. At the end of 2020, an evaluation of the alternate learning packages developed because of the COVID restrictions was undertaken to determine if the instructional videos allowed the students to confidently complete the labs in the reduced time, and to determine if the clinical alternative portfolio was effective in increasing the students' knowledge and skills in nuclear medicine practice. Ethics approval was granted by the University of Newcastle's Human Research Ethics Committee under their quality assurance scheme. A paper-based survey was distributed to the first-year nuclear medicine students following the completion of their assessments for this course. The survey included closed and open questions, and both quantitative and qualitative analysis was performed on the survey data. 94% of the students completed the survey. Of those students, only half agreed or strongly agreed that there was enough time in the labs each week. However, the majority of students watched each video at least twice, and all students agreed that each video was easy to understand. Over 80% of students agreed or strongly agreed that the clinical alternative modules increased their knowledge of nuclear medicine practice, except for the risk assessment module, where 72% of students agreed or strongly agreed. Importantly, the results indicate that the majority of students agreed or strongly agreed that the instructional videos adequately prepared them for each lab. The qualitative analysis on the open questions about the radiopharmacy labs uncovered 4 major themes. These were timing, delivery, content, and student learning. In keeping with the quantitative results, some of the comments about the length of time spent in the lab each week were positive and some were negative. Students appreciated the smaller groups enforced by COVID restrictions, but also suggested that more labs per week would be beneficial. Students believed the content helped them understand the upcoming lab, confirming the quantitative results. However, some students wanted more content in the videos. Most importantly, some students commented that the videos helped them be less anxious or stressed in the lab. 4 major themes were also revealed in the qualitative analysis of the alternative clinical portfolio: preparation for future placement, communication skills, better understanding or increasing of skills, and content of modules. Comments suggested that the alternative portfolio enabled students to get a basic understanding of clinical nuclear medicine without the need to attend nuclear medicine practice, giving them an insight into clinical situations and allowing them to gain enough knowledge to ensure that clinical placement is less of a shock to them. Importantly, it allowed students to learn at their own pace. A comparison of marks was performed with this COVID-affected 2020 cohort and the 2019 cohort. There was no statistical difference between the 2019 and 2020 radiopharmacy results. The 2020 cohort completed their first clinical placement in 2021 as second years, and the effect of the clinical alternative portfolio was assessed by comparing the results from the 2021 clinical placement for these students with the results of the 2019 cohort after the completion of the same clinical placement block in second year. Again, there was no statistical difference between the 2 different cohorts. This study has shown us that both the instructional videos and the clinical alternative portfolio were successful in terms of student learning. The students felt adequately prepared for the labs, and the videos helped with the different learning styles of students. However, only half the students felt that the reduced time in the lab was sufficient. It was an extremely difficult decision to cancel placement for this group of students. However, it was a necessity. The students felt that the clinical alternative portfolio adequately prepared them for future placements and eliminated the inequality in learning faced by students due to the varying clinical placement encounters. Little did I know in 2020 that the learning tools developed as a one-off response to COVID were to be utilised again in 2021. Placement was cancelled for the first year students again. The labs were postponed to later in the semester and run as an intensive 2-day workshop. Moving forward, The videos are now used for both pre-lab learning and revision for the first and second year students. The videos made by industry for the clinical alternative portfolio are being used to aid in theoretical classes, and the portfolio itself has been further developed and refined to be used as a potential substitute for the first year clinical placement. In saying that, the clinical alternative portfolio should be seen as a great preparation tool for clinical placement, but not a replacement. By not going out on clinical placement, the students miss out on crucial patient interactions, critical to the development of the student's communication skills, and there is an inability for the student to immerse themselves in the profession. Thank you for listening. If you have any questions about this presentation or our nuclear medicine program at the University of Newcastle, please feel free to contact me on the email address. Thank you.